I'm excited to be here. I missed this morning's introduction. You actually got here before it started raining. The skies opened up and it was ugly. But so I missed the introduction, so I don't know what they said about this 32nd annual. Did they talk about that? 32nd annual, missed a few years, so it really started like 35 years ago. And I'm pretty sure that I wasn't here 35 years ago, but I was here more than 30 years ago at the School Health Conference and have participated in over the years in a number of school health conferences. So I was delighted that A, it came back, and B, I was invited to participate. I had a huge privilege in my life as a psychologist to be employed by a school district. I am a licensed school psychologist, and I worked for 5 years for a large school district in the area. And that's where I learned so very, very much about schools, about school health services. And I just feel like you guys do an amazing, amazing amount of work. And so I applaud you. So, you're either here this morning or this afternoon because you didn't want to navigate the upstairs, downstairs room thing and you just want to sit in one place, or because there was something about this topic that spoke to you. So let me find out real quickly, first of all, how many of you are school nurses? I guess I should say, is anybody in here who's not a school nurse? Are you nurses? Are you hospital-based nurses? Okay. How many of you do not have a student with autism on your campus? Do not have a student with autism on your campus. Okay, that's important for us to all know, okay? We all know that. And interestingly enough, that would not have been true many years ago. I would have asked that question and it would have been, oh no, we never see those. They're off in the elementary school or so. But they do grow up and so, these are the things that I'd like to try to accomplish. We'll see where we go, and we'll see where you want to go with this. But we could always ask, what is autism? We'll touch on that. I thought you might be interested in knowing a little bit about what's new and what are some of the really exciting research things that are happening in the world. So I'm going to summarize those for you. I think that should be fun. We're going to talk a little bit about some issues of diagnosis because there's some really hot topic stuff going on there. We're going to talk a little bit about just a little bit about intervention. I really want to spend some time on Section 5. What is your role with students with autism? And I'm going to highlight some questions, some resources for you. And with the help of somebody who was so kind, I didn't even get your name, but what's your name? What's your name? You. Joanne. Joanne has volunteered. She's running around with blue cards for me. So I want everybody to have a blue card. If you don't have a blue card, Joanne will give you one. And this is a place where you should write down your burning question for me, okay? You should be writing that down. You can write it down now. You can write it down as it comes up. And then Joanne doesn't know this because she volunteered to pass them out, but now she's also somebody's going to have to volunteer to pick them up too. So, and so at some point before we get finished, we're going to collect those, and I'm going to have a chance to answer some of your questions. So, we should talk about what is autism just a little bit, and the simple answer is that it's a brain disorder. You think that sounds simple, but a lot of parents don't know that. Is there something wrong with my child's brain? I'm like, yeah. So you just need to think of this as a neurodevelopmental disorder that arises before the age of 2. It's really very simple, sort of simple, very complicated, but there's really only sort of 3 areas that there has to be a deficit in. So these are the 3 areas, and before age 2, something going on with social interaction, verbal, nonverbal communication, and some sort of repetitive behaviors or intense interests or sensory problems. So in one sense, it's an easy definition, but it's never an easy definition. Here's a little bit more of a list of things that might be problems with social interaction. Again, verbal, nonverbal communication, give you some ideas there. repetitive behaviors. I'm just going to give you a second to look at that. I don't need to read it to you.
And it only needs to be one of them?
No, all three.
All three.
All three. Okay? You got to have problems in those three areas, and you got to, it arises before age 2, but we don't always identify it before age 2. Sometimes we don't identify it until middle school, high school. It's a little sad. Here's some associated but not required features. So you don't have to have these. Every person with autism spectrum disorder doesn't have one of these, but these are things that might also be going on there. So you can see that, oh my gosh, now all of a sudden it's not just the neurological system, but a lot of other systems are involved as well. So it's now starting to get a little complicated. This is a real this is a real helpful concept to think about. You have unevenness in development. When you have a student or a child with global developmental delay or intellectual deficiency, previously called, intellectual deficiency, are you guys using that word yet? Yeah, previously called MR. You typically have everything's going along at the same sort of rate. It's delayed, but everything's moving along delayed. With autism spectrum disorders, you have some wide variety. This skill was on target. This skill was delayed. This skill was ahead of target. So you have some real unevenness. Or you have some development was progressing, and then it stopped. And then it developed. So you get that regressive pattern, which you don't always see, but you often see a history. Parents will often report, if there's a regressive autism, it's right around 18 months. It's the most common report, is right around 18 months, something was very, very different. Again, not all persons with autism have that regressive history, but if they do, it's right around 18 months. It's sort of a myth that people with autism have some amazing skill. If you remember, how many of you know the movie Rain Man? That's one of my favorite movies because it's such a wonderful portrayal of an autism spectrum disorder. It's just, and because it was Dustin Hoffman, I like his acting, but he was amazing because he had to really figure out how to do that, and he just did a wonderful job. But what he had that amazing skill of being able to count stuff, drop the toothpicks on the floor, he could tell you the number. That's really pretty rare to have that sort of amazing talent. Everybody with autism spectrum disorders doesn't do that. This is currently the way we look at the diagnostic categories of autism spectrum disorders or pervasive developmental disorders. We're going to come back to this later, and you're going to hear me tell you, I'll tell you now, I'll tell you it again, that the term PDD is going to go away eventually. But know that if you hear the term PDD and you hear the term ASD, those are the same. So I've had parents say, well, somebody told me my child had PDD, and now somebody's telling me that they have ASD, so which is it? And I'm like, it's the same thing, it's just a different name. And so there are right now, three PDDs. There's autism, there's Asperger's syndrome, and then there's garbage can category called PDD, not otherwise specified, PDD, NOS, sometimes just called PDD, which really, the whole page is PDD, so that one little circle over there can't really be PDD, so it gets complicated. But so the whole page is PDDs. And this one is PDD NOS, but some people get sloppy and call this page PDD. So just to give you a sense of where all this fits there, all three different kinds, they kind of overlap, it's a mess. We're going to come back to that. But when I use the word autism spectrum disorders, which I will be using often here, I just mean anything on the page. Okay? If I sometimes during the course of talking to you this afternoon use the word autism, trust me, I'm still talking about the whole page. Okay? So I already gave you a hint on this, but when does autism start? Really very early, and possibly even prenatally. Yeah. Even those kids that show that sort of regression at 18 months, chances are there's probably something going on prenatally. The most obvious symptoms emerge between 24 and 36 months. But I don't think that it just sort of all of a sudden starts then. It's just that that's when it sort of emerges. What do you think the answer is going to be when I push the button here? Much more frequently than it used to be. One in, we'll go with 1 in 110. Why don't we go with that? So that's 1%. That's why it's not surprising that every single one of you raised your hand that you have somebody in your campus with an autism disorder. It's still more likely in boys, so 1 in 70. So think about it. You got a classroom of 20, 22, 20, 25, 30? 30? Classroom of 30, right there you got two, you're gonna see an increase in frequency. And definitely we've seen an increase over the years. I'm getting pretty old here, and the years that I've been practicing, definitely an increase. When I was in training as a fellow, what I learned was 1 in 10,000. 1 in 10,000. Now it's 1 in 110. Okay, and partly that's because we have different diagnostic categories and we are embracing more people in the spectrum. More people are showing up on the page than used to, but that isn't the whole answer. There's got to be something that's causing an increase in this neurodevelopmental disorder. But this last point is important. More children will be diagnosed with autism this year than cancer, diabetes, HIV combined. Okay, what's going to show up here when I push the button? Question mark. Drugs, probably not. Drugs as in, what are you thinking? Prenatal drugs? Genetics, I heard. Lack of prenatal care, I heard. Maybe not. Immunizations, probably not. Environmental something, probably. Let's go see what happens when I push the button here. It's definitely neurodevelopmental. There's not one single cause, and that's why it all looks so different. And maybe someday, when we're really, really, not me, but when somebody else is really, really smart, maybe we'll have some more specific categories or types, and it'll be more clear, like, oh, this causes this, and this causes that. But right now, it's like so different. It's definitely not one cause. It's definitely not one gene. It's not like we're going to go, oh, Down syndrome is caused by this genetic problem, and autism is caused by this genetic problem. It's not going to be a single gene. There are genetic features, but it's not going to be one gene. It's not so much, there is some inheritance, and I'll talk about that in a minute, but there's also sort of these gene mutations, spontaneous gene mutations. But it's not genes alone. So the best answer you can give to what causes autism is, there's a genetic component that collides with an environmental component that we don't know what it is. And if you have both, you might get autism. If you don't have the genetic component and you have the environmental exposure, you won't get it, and if you have vice versa. The problem is we don't really know quite yet what those environmental factors are. So as I said, I thought it might be fun for you to kind of hear what's new, where is the research going? And the Autism Speaks is a huge advocacy organization for autism. And they made my job really easy today because at the end of every year, they publish the top 10 research achievements for the year. And they have some amazing writers who are great at translational writing and can write it in a way that all of us can understand it. So I'm going to share with you just brief snippets of the top 10 research activities for 2011. And if you want to know more about it, you can go to autismspeaks.org and you can read this, and trust me, it's very understandable. It's stuff we can all understand. You don't have to be genetic scientists to understand this. So one of the pieces of work was talking about, okay, what is the prevalence? And also ask the question, a lot of our research on prevalence and incidence has come from clinical populations. So you get a population of folks who've been out of a clinic, who've been diagnosed, and then you do some math and you figure out what's the prevalence rate. But what if you screened a population? What would that tell you? Would it be different, say, from the 1 in 110? So a really gigantic study was done in Korea. 55,000 Korean children ages 7 to 12. Every kid got screened using parent-teacher questionnaires and very standardized diagnostic methods. That's a lot of people. And it'd be like coming into your school and say, we're going to screen every single kid in this school times many, because 55,000, okay? And what they found, oh my gosh, 1 in 38. So it probably at least tells us that the 1 in 110, if you base it on a clinical sample, it may be that it's really a bigger rate if you based it on a population screening. They also found that 2/3 of the children who had the symptoms were in mainstream classes, were undiagnosed, and were receiving no services. So I'm not gonna tell you that you really have 1 in 38 in your schools, but I am here to tell you, and you already know this, but I'm just saying it. You got kids in your school that have autism spectrum disorders that have not been identified. How many of you would agree? Thank you. So keep that in mind when we come back later to the role of the school nurse. What does it mean? There's now a big study to complement that one that's going on in the United States now. Is it because there's huge differences in United States and Korea? Is it there's big environmental differences in Korea and the United States? Is that going to make a difference? Who knows? But in Goyang City in Korea, they've now implemented a more universal screening. And in fact, and not because of this study, but because of just the belief that it's really prevalent, the American Academy of Pediatrics recommends screening all children at 18 and 24 months. Texas Medicaid requires screening of all children at 18 months. So that's probably not something that you all as school nurses, that's not the screening you're going to do. Who's doing that screening? The pediatricians, okay? So big pediatricians and family practitioners, and nurse practitioners that work in family practice and pediatrics.
Are they required to tell the parents the result of the screening?
Well, that's an interesting question. I can't imagine that you wouldn't. I can't imagine that, but I'm just baffled by that because but I don't know if the law specifically says that you must tell the parent. I'm not sure, but that's an interesting question. We may come back to that one. So let's talk about what some interesting stuff is going on with the question of genetics. We've known for a long time, or it's been the stated science for a long time, that when one twin has autism spectrum disorder, the chances are 90% that the other twin would have it. That's been sort of the stated science. But, and the likelihood of a fraternal twin, a non-twin sibling, was 15%, and is that right, or the non-twin? The sibling would be 15%. So last summer, July 2010, there was a giant twin study. Giant because 192 pairs of twins is a lot to study and hang on to for a long time. And what this study showed was that the rate was lower, 70%, not 90%, which we've been sort of hanging on to for a long time, and that higher than we expected for fraternal twins. So that tells you there is a genetic component there, it's kind of sad to think, oh, you've got to have two kids with.
Makes you wonder about the environmental factor because with twins you're typically going to have them in the same environment, almost identical.
That's right. That's right, including their prenatal environment. So again, there with the prenatal, that twin pair was exposed to the same environment. I don't know that in twin research, not in autism, but in twin research in other things, there's some pretty interesting stuff where they find twin pairs that have been raised separately, and they've done some interesting things to learn about genetics. I don't know that there's a significant, I don't know if there's a study going on with that, and if anybody's found all the twin pairs where one has autism but they weren't raised together, but well, that'll be good stuff when it finds it. So yeah, the conclusion was that the genetic predisposition really does affect the risk, and that the environmental involvement is there. Another interesting piece of work was with baby siblings. So the question arises, this is the previous science. We've been saying for a long time that if you have a child with autism, your next child has a 3 to 10% chance. And parents want to know that. Parents want to say, oh, I'm dealing with a child with autism. You know, what is the risk for the next child? Should I have another child? Or I've already had another child. Do I need to be looking for this thing in my younger child? And so 3 to 10% has been the previous science. And then this in 2011, there was a very large study, 664, that's large, of infants who had one or more siblings who had already been diagnosed. And these babies were enrolled at less than 6 months and followed for up until they were 3. Had expert clinicians watching them, and just the best methods for diagnosing. And the new findings were that the baby sibling had a 20% chance, not 3 to 10, but a 20% chance of developing ASD. And if you have more than one sibling, then your chance goes up. So I used to think, and I can remember when I was early on in this work, and I'd see parents with a child with autism, and then I ran into some families that had 2 children with autism, and I'm like, it seems so unfair. So unfair. And now, think about it, now the risk is, if they have 2 children with autism, they have a very high risk of having a 3rd child with autism. A little bit higher risk for the baby brother than for the baby sister, which fits with what we know about the overall gender differences. And it doesn't seem to matter if you have a very severe child versus not a very severe child. That doesn't seem to affect the risk for the baby sibling, which is interesting. So, the implications are, if a child has autism, you really need to be watching really closely for those younger siblings. Okay? What I find in my practice is that there are many times when you've identified a child and I look backwards, I look at the older sibling, and I go, it's there too. But maybe the younger sibling had a more dramatic case or more behavior problems or something that was kind of overshadowing. So my suggestion is you don't just look at the babies, but you look at the olders too. So you just take a look at the siblings and pay attention to the siblings in a family where there's one or more known. All right, some more genetic research. Remember, I mentioned that we're starting to learn that it's not just the inheritable patterns that we've known for so long, like as in Down syndrome, but that there are these tiny little genetic changes that happen, who knows why, who knows where, who knows how, sort of de novo genetic changes. And people are starting to look at that. Because we have such amazing technology now, we can look at DNA microarray technology and really look at these little tiny little deletion or little differences in the repetitive patterns. So these things called CNVs, copy number variants. And in research that's looking at that, they're finding that there really are a number of genes that are the genes that are involved in brain development that are starting to have these little micro changes. Well, it's the genes involved in brain development that are likely to be the ones that are implicated in autism spectrum disorders. So there were actually a lot of research in the past year, probably the last, it's not something you just whip out in a year, so it's probably been going on for a long time, but there were 3 published this year. One said that there were a lot higher rates of spontaneous genetic changes in children with ASD than their non-affected siblings. Another study said that the changes, these little mutations, were found both in the eggs and the sperm. And so really early, something is going wrong with some of these. And that there was a really strong link between autism and some specific known regions in the genome that we know are associated with sociability. How many of you have heard of the term Williams syndrome? Anybody have a student in your, you've probably heard of it. It's pretty rare, but anybody have a student with Williams? So Williams syndrome kids are real sociable. They're like the opposite of kids with autism, but there's some work with Williams syndrome that says, ooh, they have gene problems right here, and deletions, and in that same area of the gene, there's some work that says kids with autism have extra copies, whereas the kids with Williams have deletions. So they've identified that zone. But again, it's not going to be one region of the genome. It's going to be, answers are going to be coming from all over the place. There was another study that looked for, they took people with autism and they looked at their genes, and they found that they were able to identify specific genes that had correlates with all the symptoms of autism. So people who are like in this field that can't pretend to understand really are seriously looking for what are those genetic factors. And the field of genetics is just rapidly changing, and so there are going to be some answers. We do know that kids who, there is a bit of a relationship between parental age and autism. And that could be both from the mother and or the father, and that sort of helps explain that genetic micro changes too. All right. Here's another genetic study that was pretty amazing because they used postmortem brain tissues. The autism community, as a community, is so concerned about research, and so there are what's the word I'm looking for? Brain banks or families, donating their brains, and a lot of times not just the people with autism, but family members, grandparents really say, well, I'm going to donate my brain to science so that you can study normal brain, typically developing brains, and brains with autism. So this was a study that used postmortem brain tissue and found that there were really dramatic differences in the gene expression between those with and without autism. And what was interesting, this study said, you could have autism that looks like this, and you could have autism that looks like that, and the brain changes look the same. So it's not like the genetic differences look like this for one variant of autism, that there's some commonalities that then manifest quite differently. Some gene networks that are being discovered that are involved in cellular functioning, and they said, oh look, low levels of this particular gene, and oh look, high levels of this particular gene. So that's just to give you a flavor that there's a lot of genetic research going on there. I think this one's kind of interesting. They found that in people with autism, there were differences in the gene expression in the frontal and temporal periods. In persons without autism, there was a difference. They looked at the gene expression in the frontal versus the temporal. We saw these differences, and then in the patients with autism, like those differences were gone. So there's like something going on there, so really as a marker. Again, the implication is that these genes are can be maybe turned on very, very early embryonic development. So that's interesting. So some other research is probably saying, well, is there anything we can do to prevent that? And there's some interesting work been done with prenatal vitamins, and you all know this, but prenatal vitamins contain a lot of good stuff, including good stuff for brains, folic acid. We know that. So this research had a bunch of children with autism and a bunch of children without autism. They were little ones, 2 to 5 year olds. And they interviewed the mothers. That's a limitation of the study. It was just an interview, but they interviewed the mothers and they said, did you or did you not take prenatal vitamins before conception, during pregnancy, and while breastfeeding? And what they found was that for the mothers who had prenatal vitamins 3 months before conception and at least 1 month after conception, half as likely to have a child with autism compared to no prenatal vitamins. Yeah. And multivitamins and fortified cereals, nah. Got to be those prenatal vitamins. But how many people take prenatal vitamins 3 months before conception? Yeah? Okay. If you all are in the childbearing age, if you have family members in childbearing age, if you are influencing your high school students who are in the childbearing age, maybe we need to be thinking about the protective benefit of prenatal vitamins much, much earlier than once you've been diagnosed as being pregnant. Part 2 of this study was that then they took DNA from all these mothers and all these little 2 to 5 year olds, and they found that there were some gene variants associated with the folate regulation. So this is how it goes. If the mothers, over here, if the mothers did not take prenatal vitamins, the women with either 1 or 2 gene variants had a 2 to 5 risk of having a child with autism, and children with just one of those had a 7 times the normal risk. So these were the mothers who did not take prenatal vitamins. But if they took prenatal vitamins, they only had 2 times the normal risk of having an autism. So the risk for autism goes down if you took prenatal vitamins before conception. That's pretty interesting, isn't it? Did y'all know that? I didn't know that. That's your oh my gosh, piece. I'm going to get to you in a second. Yeah. I did not. I don't know. I don't have any data on that, and that's a good question. Is breastfeeding a protective factor? I'm pretty sure somebody in the country is looking at that, so ask me in a year and I'll look for the answer.
I thought it said that.
Well, it asked if they were taking vitamins during breastfeeding. That was one of the questions, yeah. So that was a pretty interesting study. Now I'm just going to do this briefly because I don't pretend to understand this mouse stuff, but this is really interesting stuff. So, and genetics has changed, oh my gosh, so much since I took genetics in college, so I don't understand it. But, they do genetic research with mice. And they have these amazing ways of genetically engineering the mice. So they can have a mouse that does what they want it to do so they can study it. And they call them knockout mice. They delete certain genes and then they go do the research. So they've been able to develop a knockout mouse that is very akin to the genetic pattern in some of these people with autism. And the mice actually show features of socialization differences and repetitive differences. The communication difference, I can't study in the mice, but the others, you can see socialization and some of the other features of autism. And so the previous mouse model, it's been working okay, but it only shows up some of the core symptoms. And so this last year, everybody's all excited who's in this field because they've developed this new mouse who shows more of the autism features. So people think that's pretty good. And they did have hampered communication because mice do communicate sort of non-verbally with each other. And they were able to see differences in communication, social challenges, and some interesting repetitive behavior. So now future research can use this new mouse model, which is more closely matching the autism spectrum disorder. And then they found some people that had a really, really rare inherited mutation in this particular gene. Very rare, not too many people with it, but they studied them. These people have cortical dysplasia, focal epilepsy, and it's a very small sample, but 2/3 of those people with that disorder also have autism. So they're like, oh, look, people with this gene problem are likely to have autism. So that's just to give you a flavor of some of the genetic research that's going on in the field of autism. Another cool thing about this is this new mouse responded to risperidone. How many of you have heard of risperidone? You probably have kids in your school that are on Risperdal. And Risperdal has been approved for the irritability of autism. And lo and behold, risperidone actually reduced repetitive behaviors in the mice. So now people are very excited about this new mouse model because you can really use it to test. That's how they test a lot of the drugs that we get marketed to us, that they were first tested on animals. All right, so another piece of research says, there's got to be something going on in that brain. What exactly is going on there? And there's some kind of signaling abnormalities that are going on. We've often said for years and years and years that about a third of people with autism also have seizure disorders. And as you heard, seizures, abnormal, something going on in the brain. We know that there's some genes that are associated with brain signaling. There's been some work with imaging, brain imaging, that shows that people with autism have higher than normal brain activity in certain regions. So imaging is helping. But this study, again, was with mouse, but they engineered these mice that were sensitive to light-sensitive proteins in a particular area of the brain. And so they would send these little, you can see the picture here, they'd send a little light through the fiber optic cable implanted in the brain, and if they sent in blue light, it would excite, and if they sent in yellow light, it would inhibit. And then they watched how these mice interacted with new mice, and with play objects. So again, simulating the autism. And they found dramatic things were happening with these mice. They were like all of a sudden losing interest in socializing with new mice and having difficulty adjusting to changes in their cages. And then they would re-stimulate them, and then all of a sudden they were like back socializing. So what you see is that they're using optogenetically engineered mice to simulate some of the core features of autism. And we may think, who cares? Who cares about mouse research? But if that kind of research weren't going on, we wouldn't be having any breakthroughs in this interesting disorder. There's been a lot of speculation that autism might be associated with some immunodeficiency. And so for years we've been saying, okay, there's some evidence that the immune system abnormalities are more common in children with ASD. And people are still working on that, trying to figure that out. So a very large study was done in 2011 looking at specific levels of cytokines, which are your markers of inflammation, and had a big sample. And they found in this sample that, lo and behold, there really were higher cytokine levels in children with ASD versus not. And primarily that was showing up in those kids that reported that regressive type of autism. And but you're still left with, okay, what does that mean? Is it the inflammation that causes the symptoms, or is it the inflammatory response is a result of some other autism process? So we still don't have answers, and it's not good enough to say to families, oh, it's an immunological problem. But one of these days we'll understand that a lot better. I mentioned that the American Academy of Pediatrics is recommending screening of all toddlers 18 and 24 months. And heretofore, one of the best and only tools we've had is the MChat. How many of you have heard of the MChat? That's what many pediatricians are using to do this mandatory or this recommended 18 to 24 months. In the state of Texas, it's mandatory for children receiving Medicaid insurance, and many pediatricians are starting to use this MChat. So the problem with the MChat is that it really only is good for 18 months and up. And we're beginning to get a picture that you can pick up autism much younger, so how are we going to do that? So this piece of research was trying to develop a new tool, and could you come up with a longer name for your tool? Communication, Symbolic Behavior Skills, Developmental Profile, Infant Toddler Checklist. You can't even say the acronym, so they'll have to work on that one. But they've come up with a new tool that works for much younger children. So we'll probably be hearing about new tools that allow us to screen. So that's your top 10 pieces of research, just to get you a flavor of the kinds of research that's going on. There's tons of research. Here's the hot new topic. Some of you have probably heard of this. Hot new topic, Diagnostic Criteria Changing. You've been hearing about this? Yeah? And I'd be interested in knowing what you're hearing. So you all know the DSM-IV. You've heard that term forever. And just to remind you, the DSM-IV is created and produced by the American Psychiatric Association. People make diagnoses out of the book, and insurance companies, that's what they use. Many service service providers, it's like if you meet these criteria, then you're eligible for our services, such as Social Security, SSI. So it's being revised. It says DMS, that's wrong, it's DSM. It's being revised, it'll be the DSM-5, which is scheduled to come out in 2013. So remember that I showed you that big box in 3 ovals, and everything was autism spectrum disorders in 3 different categories. The proposed DSM-5 is those 3 circles will go away, and we'll have a single category, autism spectrum disorders. See, so scratch out pervasive developmental, that's going to go away. Scratch out this, and you'll have this. Okay, so that's the plan. Okay, not till 2013. And what we don't know, there's a lot of things we don't know, and people are starting to, I don't know if they're panicking early or being proactive early. I haven't quite decided, but first of all, a background on why that's happening. And they've actually researched that. And my own clinical practice tells me that I spend way too much time fussing over it. Does it go in this box or this oval or this oval or this oval? And it doesn't really matter. It's somewhere on the page. And the criteria are overlapping, and it's been a nightmare. And so it's just not a useful categorization system. And people done research. They've taken kids that have been diagnosed, and then they've re-diagnosed them, and they've found, if these people do it, they end up in that category, and they always end up on the page, but they don't end up in the same category. So those categories really are very, very widely varying. So this was kind of an interesting study where they took a bunch of kids that had been, they said, we want kids that their diagnosis has changed over time. Maybe they started out as PDD-NOS and then they ended up as Asperger, or they started out as autistic and they ended up as Asperger. They took this whole bunch of kids whose diagnosis had changed, and the kids who changed the most were more likely to have associated other disorders. Because you have to remember that if you have a diagnosis of autism spectrum disorder, that doesn't prevent you from having anything else. And if you only look at one diagnosis and you forget to look at all the other, you're going to mess up your clinical picture. So I read this somewhere as I was gathering information for you all, that there is a new category being proposed, social communication disorder, or a pragmatic language disorder. And that seems to me to be a good idea because we don't really have that right now. We don't have a category for that. But you all know, and your speech pathologists know, that pragmatic language is a big problem, and that's a big feature of autism. So we'll keep our eye on that one too. Why are people now upset about this? What are you hearing? Are you hearing people going, oh, this is awful? Yeah. Why are people upset about this? Right, there's a big fear in the autism community that if you put it all in one bucket, that you're going to lose services. A knee-jerk reaction was, well, Asperger's going away, so everybody with Asperger's not going to get any services. But if you look at it, Mark, that's not right. It's just if you had Asperger, you just now have autism spectrum disorder, which we've always said. Okay, so it's not you had Asperger, you've lost your services. But in the bigger picture, there's people really worried about this broad spectrum, high-functioning kids and adults without major needs. Are they going to still be fitting into the eligibility for services? So people are getting nervous about that and worried about that. Maybe rightfully so, and maybe overreacting. The important thing to know is that it's gonna change over time. Important thing to know is that the autism community has a massive network. Their grassroots efforts, and they can affect change. So letters are being written to the American Psychiatric Association, and people are going to be like all up in arms. And I think it's going to probably turn out okay. If someone has an autism spectrum disorder, it's not the diagnosis that gets you services. It's not the diagnosis that gets you services in schools. What is it that gets you services? Need. If you have a need, that's what you look at. So you don't look at what the name of the diagnosis is, you look at what the need is. The other thing that we don't know, and I haven't read this yet, but the DSM will change. I don't know how long it will take before the state categories for education will change. They won't happen at the same day, so we'll still have autism under federal IDEA law and under state code, and that language won't exactly match the new DSM, and so then there'll be this period of chaos, like, are we going to go with what? And so I would say that probably in 2013 and 14 we'll be like having some challenges in terms of which kids will be identified as students with autism. So keep your eyes up on that. A few intervention issues. What medicine does my child need? Should we try gluten-free, casein-free diet? Do we need to get an MRI? I heard they have gut problems, so can we go do something about their gut? These are some of the intervention issues. What is ABA? These are some of the intervention issues. Gluten-free, casein-free diet. Let me just give it to you really quickly. If it helps, great. It's not going to hurt. If it helps, great. It's not for every kid. So just because you get a diagnosis of ASD doesn't mean you should rush out and be on a gluten-free, casein-free diet. So if it helps, great. It's hard. It's really, really, really hard to do a gluten-free, casein-free diet. So if you're not really committed to being able to do that, you don't have the resources to be able to do that. If you try it, it doesn't work. So those are some of the big issues, and I can come back to that if that's an area of interest to you. Does he need medicine? Bottom line, there is no medicine for autism. No medicine for autism, but there's medicine for symptoms. If you have inattention hyperactivity, we can treat that. If you have anxiety, we can treat that. If you have OCD, we can treat that. If you have rages, we can treat that. There is no medicine for autism. Okay, does that make sense? What is ABA? Oh, I don't know if we can get into that, but the definition of ABA is applied behavior analysis. It's old. It's not new. It's old. It's been around since the 60s. That's old. It's just basic. How many of you took Psychology 101 in somewhere? Most of you, okay? You learn stimulus, response. You learn principles of reinforcement. All of that, that's ABA. It's nothing magic. It's good, solid behavioral principles applied to people. Applied, the word applied, okay? We can come back to that one if that's of interest to you. What tests should a kid have if they're been diagnosed or maybe being diagnosed? I put this one up because this one showed up on some website, okay? Parent Googles it, and there's some website, Autism PDD Support Network, and this is the list that showed up. So they walk in going, okay, I need these. Yeah, well, did you look at the website? Was it a good website? Do they really need these? And the answer is, they don't need all these. There's not evidence for these. But the website said, and it had autism on the name of the website, scary stuff out there on the internet. So a lot of medical tests are not indicated. The AP guidelines say you only need really these tests. Everybody should have their hearing tested. Everybody should get lead screening, and kids already do because that's part of their well-child visit. Everybody should get a developmental assessment. Already do. It's part of their well-child assessment. And there's currently not evidence to say every kid with an ASD needs to rush out and get an EEG, an MRI, a CT, or any other neuroimaging, because it's not going to tell you anything. Oh, but what about all these gene stuff you just told us about, and all these mice and these genes and all that? Should we go get our genes tested? Not quite there yet, folks, so I want to be careful about that one too. If they have dysmorphology and there's something that looks different about them, yeah, they probably should get genetic screening. But not every kid. If they have global developmental delay, intellectual deficiency, MR, whatever word you want to use, they probably should get some. Let's answer this question first. So I just want you to throw out some things you talked about. Just one-liners. What is the role of the school nurse? Advocate. I'm sorry, just a minute. Safety. I love that one. Making sure everybody's safe.
They should be part of the assessment team.
They should be part of the assessment team. I love it. And if you're not, worm yourself in there. Don't let somebody tell you don't have something to contribute. You guys are probably the best people for taking a family history. You have permission and you have skill. in a way that an educator doesn't have permission and skill to ask all kinds of questions. So get yourself on the assessment team. Get yourself on the reassessment team, particularly the reassessment team. What other roles?
Educating the parents.
Educating the parents about,
Well, like, if, for instance, like, letting them know, like, what's real and what's not, like, with all these flaws and stuff like that.
love it, love it. Educating the parents, keeping that, one of the words I use when I make a diagnosis of autism, almost invariably one of the next things I say to parents is, you've probably already done this, but I'm going to advise you not to Google autism. And they smile and they go, because they've already done it, but they're overwhelmed. And I give them lots of permission to not do that. And I do what I call internet prescriptions, and I give them websites to go to. And I'm going to give you some here so you can give them some. So guiding them through the junk could be a huge, huge role that you could play. What other words? Support. I think that's excellent. I think that sometimes parents get really tangled up with the educators, they get tangled up with the diagnosticians, they get tangled up with the administrators, and who's there to just be there for them? Sort of an unbiased, if you can. I don't know if you can be unbiased. What other words? Advocate.
Empower the parents of not the English language parents, because they're the ones left out of that big autism.
Excellent. Don't forget about the people who have other challenges, secondary language challenges, multiple diagnoses challenges. Okay?
I think about, we have the cool down room.
Cool down
They
room.
know they can always come to our clinic when
Okay.
they're just about to explode on something.
Okay.
Come down.
Okay, so you are the safety place sometimes. Is that what you meant by safety, or did you mean keeping kids safe when you said safety?
Covers both.
Yeah. Okay. Did we miss any? Did we miss any? Let's see what
You say advocate, one thing that's really important is as a child grows through the school years, you're the one constant.
You are.
The teachers of each successive grade have heard the horrors,
Right.
they've seen the meltdowns.
Right.
And you can get in there and help the teachers predict what
Right.
to do so that they don't have.
So
a meltdown.
that's more than advocating. That's really you can also be a part of the intervention planning. You can also be the memory. Remember how far this child has come. I knew him when, and that often is really helpful. Let's see real quickly if I have any others that you didn't have. Answering parents' questions, accurate advice about diagnosis and interventions. Don't let them go do wacky things that they don't need to be doing. Linking them with resources. Identifying their needs. Join the ARD committee. Please get yourself on those ARD committees. Assessment teams and ARD committees. Please get yourself on them. Guide parents' internet searching. We talked about that in advocating. Okay, you guys have so many questions here, and we have some time here. So let me.
Can I just say that the questions that we don't answer, can we put them on the website? Answer, do you think you have time to?
I might be able to do that. I might be able to write the question and then write my answer, and then you'll find those somewhere. Yeah. Should men take prenatal vitamins? I have no idea, but that's a good question. There's a question here about is ADHD and autism being confused? I hope not. If ADHD and autism are being confused in your schools, you've got some diagnosticians who don't know the difference between autism and ADHD. That's pretty scary. But they can coexist. So you might be getting a little of both. There was a question here about an article in Time Magazine about shyness. And is shyness really an autism spectrum disorder? That's an interesting question that I can't answer, but keep your eye on what people are talking about that. I think that shyness is often not just shyness. I think it's an anxiety disorder. I think it's a selective mutism, and it possibly could be an autism spectrum disorder. Somebody said they heard on the news, oh, good news, kids outgrew autism. I used to believe that you never outgrew autism. I still believe that you don't really outgrow autism, but I am a huge believer in early intervention. That's why I work for a 0 to 3 program, and if we don't diagnose it before age 3 and get going with it and call it and name it, then we are doing families and children a disservice. So yeah, kids will get much better, their course will be much better, but in my heart of hearts, maybe it's just because where I came from, I believe that there's still a nidus of an autism spectrum disorder there. But you might be very functional. You all know people, you know adults that have autism spectrum disorders. We have amazing people doing amazing things all over the world that have autism spectrum disorder. So it doesn't mean you can't produce, but I'm not sure you ever really outgrow it. What do you suspect the environmental factors are? Who knows? They could be anything. That's where people are really searching. There's a question in here about bipolar disorder. And is there a link between autism and bipolar disorder? Again, nothing protects you from having both. Scary thing, how sad. But you could have both. If there's a positive family history, your increase for bipolar disorder is going to go way up. I do think that there are some children, very young children, that I see who look like they have autism spectrum disorders, and after a few years, they don't look so autism spectrum, they look more bipolar. As an older kid, I don't think you'd make that confusion, but as a 2-year-old, you might. So that would be something to pay attention to. I'm really sorry. I thought we had till quarter till. Off the whole day. Okay, we're good? All right. Get up and leave if you need to. I love this one. What is the best approach to discussing the possibility of a child having autism with a parent? As a school nurse, or I think the person who wrote this said, this person happens to be a personal friend. How do you talk about autism? My belief is, I should preface it by saying, because I've so many times in my life I've had to make a diagnosis of autism, I guess I can do it. And I can do it, and I can say that word and come out of my mouth. I can still remember when I was in training, learning how to say the word suicide. It was like, it wouldn't come out of my mouth. But as I had to do it more and more, I can say suicide and I don't choke on it. I can say autism and I don't choke on it. Some people still do. But my belief is that if you think that's what's going on and you have some pretty good evidence, put that word right out there on the table and let somebody who knows what they're doing say whether it's true or not. But if you hide it and you don't say, well, no, I think you're doing that family a disservice. You probably wouldn't do that for other things. You wouldn't go, I don't know if I want to tell them I think this is diabetes. I don't know if I want to tell them that I think they have a rash. I mean, you wouldn't do that. So why hide autism spectrum disorders? Why hide depression, anxiety, anything else? That's my belief on that. Oh my gosh. How do you do vision and hearing screening on a severe autistic student? You have to, right? Because you're supposed to, because that's part of your job. But, come on, there's a point in which you say, can't do, no can do. You can send them to a specialist who, that's their job. Okay? All right. I will go through these cards, and if there are some really cool questions that I can answer, I'll create a little one-page blurb, and it'll show up with this PowerPoint. Oh, and at the back of this PowerPoint, there is the autismspeaks.org website you need to know about, and there you have a school nurse community toolkit. It's got some cool stuff in it. Autism Speaks, that's a good one. And the Autism, those are the two places that I always send families. So take a look at their site. Thank you.